to summary of the project. The project is all about creating a user-friendly system for managing appointments and medicine pickups at the clinic and University Teknologi Mara UiTM Arau. The system will make it easy for students to book appointments online. They can choose a date and time that works best for them, which help reduce waiting times at the clinic. For getting medicines, students can decide whether they want to pick them up from the clinic or have them delivered by a special van service around the UiTM Arau campus. This gives students flexibility based on their needs and schedules. The system will also ensure that students' personal health information is kept safe with secure login and profile management features. They can update their details, check their medical history, and receive reminders for their appointments and medicine pickups. These reminders will help students stay on track with their healthcare needs. Overall, this project aims to make healthcare services more accessible and convenient for UiTM Arau students, improving their overall experience with the campus clinic.
So next we move to the objectives of the project. So for the first one is can ease the users to get medicine or schedule doctor appointments when they are sick. Next one is can enhance the practical skills and hands-on experience of the staff and also doctors in the UK. Other than that, the objectives of the project is to specify what type of medicine that the users need to get. The fourth one, to allow the users to request a medical certificate, which is MC, if they are unable to attend classes or any programs. For the fifth one is to offer the users to choose between walking in or getting picked up if they are the university residents or non-residents. The last one is to calculate the total price of medicine and also delivery.
Okay, now I will continue explaining about the analysis, which is input, process and output. The first one is input. The input of this group project is enter an email UiTM, name and metric number for registration, enter name and metric numbers to log in, choose to book an appointment or to get a medicine, choosing the type of medicine, entering the quantity of medicine, choosing if you want to add more than one medicine, entering resident status, choosing to walk in or to use the delivery service, entering the time to make an appointment, option for needing an MC, entering the type of diseases, entering the date for the MC, and last but not least, entering college name and room number for delivery preference. So in our group project, we only have one process, which is total equal to 1.0 times quantity. For our group project, our output is to display confirmation message for successful registration and login, display an error messages for failed login attempt, display total price for the selected quantity of medicine if you choose to using the delivery service, display of medicine option, display of doctor schedule based on the selected time, display the available times for picking up the medicine if walk-in is chosen, display appointment reminder with details, doctor's name, room number and time, and lastly is display the MC with the user's name, date and type of disease.
Okay, now I'm going to explain about the project of our group project. So when we start, the program will display please register first, and then we'll continue to display enter your UiTM email, your name and metric number, and then the user will input the answer, and then the program will display you have successfully registered, and display please log in, and it will continue to display enter name and metric number. If the user enter the valid name and metric number, the program will display login successful. But if the user enter invalid name and metric number, the program will display login failed, incorrect name or metric number. Please try again. And the program will display again enter name and metric number, and it always looking if the user enter invalid name or metric number. And then the second page, it will continue. The program will display do you want to get medicine for number 1 or book appointment for number 2, and the program will read the option. If the user enter 1, it will display type of medicine. One is first is Panadol, second vitamin C, third Clarinis, and the fourth one is the Zepavena expectorant. And then it will display enter type of medicine, and then the program will read the medicine that entered by the user, and then the program will display enter the quantity of medicine, and it will read the quantity, and then it will continue to display do you want to add more medicine. If yes is Y and no is N, and then the program will read the that medicine. If the user enter Y, and then it will looping again, it will continue to display the enter type of medicine. If no, we're going to continue to the next page. Okay, next we continue. If the user did not enter Y, which means they enter N for no, they didn't want to add more medicine, the program will display do you want to walk in to UK or we deliver your medicine, W for walk in, D for delivered. And the program will read the option that entered by the user. So if the user enter W, which means walk in, the program will display time available to pick up. Monday until Thursday is 9 a.m. and until 4 p.m. Friday 9 a.m. until 12 p.m. and 2:30 p.m. until 4:30 p.m. And the last one is Saturday and Sunday, it will display closed. Okay, next, if the user enter D, which is delivered, the program will display notes. This medicine delivery service is charged RM1 per quantity of medicine, and it will continue to display are you resident or non-resident, or for resident and for non-resident. And then the program will read the status 1 that entered by the user. If the user enter R, which is resident, the program will display enter your college, and then the user will enter their college, and program will display enter room number, and the user will enter their room number also. And then the program will calculate the total, and that will explain the next page, and then the program will display the total price which have to pay by the user. If the user enter N, which is non-resident, the program will display sorry, we are not delivering to non-resident, please take your medicine in UK by walking, and then it will continue to display F, which is going to explain in the next page also. And then if the user enter option 2, which is book an appointment, the program will display time available that are going to explain in the next page also. And if the user enter option other than 1 or 2, the program will display you enter invalid number. Please choose again, and then it will display again G, which is in the first page. It will display to enter, which is option 1 or 2 only. And then we continue to the option 2. The program will display enter the time you want to make an appointment in 24-hour system, and the user will enter the time. The program will read the time. If the time is more than or equal to 9 or n less than 11, the program will display doctor's name, Dr. Aminuddin Ali, and room number 1. If the time is more than or equal to 14 and less than 17, the program will display doctor's name, Dr. Sarah binti Jaafar, and room number 2. And then if the time entered by the user is more than or equal to 18 and less than 20, it will display doctor's name, Dr. Said Effendi Mokhtar, and room number 3. If the time is entered by the user is not in this 3 range, the program will display sorry, the time you enter is not in the list of UK operating hours. Try it again, and then it will display again D, which is the display time available, and continue to display. If the time entered by the user is valid, the program will continue to display do you want to walk in to UK or we pick you up, W for walk in and P for pick up. And then the program will read the option entered by the user. If the user enter P, which is pick up, the program will display are you resident or non-resident, R for resident and for non-resident. If the user enter W, it will display E, which is going to explain in the next page also.
So we move on to the 6 slides of the flowchart. If the users enter letter R in the input, the program will display enter your college. So the users need to enter their college, and the program will read the input, and then the program will display enter your room number, and then the users also need to enter their room number, and then the program will read the room number, and then it will display the appointment reminder that include doctor name, doctor room, and also time of the appointment reminder. And also it will display to function F, and function E will display the appointment reminder that I have stated just now. But if the users enter another letter other than R, the program will display sorry, we do not provide pickup services for non-resident students. Please go to UK by walking. So we move on to the 7 slides of the flowchart. It starts off with the function F. The program will display do you need MC medical certificate. Y it stands for yes, and it stands for no. So the users will key in the input, which is whether it's Y or no, Y or N. So the program will read the input. If the users enter letter Y, the program will display type of diseases. So the users need to enter their diseases that they have, and then the program will read the input. Next, the program will display the date of the MC, including date, month, and year. And the users will key in the date of the MC that they want, and then the program will read the date, and then it will display this is certified that the individual known as their name should be allowed absence at date and currently suffering from the disease. And it will end the flowchart. And if the users enter other than Y, which is no, it will terminate the program and automatically end the flowchart. So we move on to the last part of the flowchart. So for the first one is calculate total function. This function calculates the total price based on the quantity provided. It takes 2 inputs, which is in total quantity and out total. The calculation is straightforward, which is total equals to 1 times quantity, and it returns to the total price. The second one is display time available function. This function displays the available times of doctors on duty. The output lists to the doctor and their respective objective duty times as follow. Is the first one is from 9 a.m. to 1 p.m. is Dr. Aminuddin Ali. For the second one is from 2 p.m. to 5 p.m. is Dr. Sarah binti Jaafar. And the last one from 6 p.m. to 8 p.m. is Dr. Syed Effendi Mukhtar. We move on to the last part of the function flowchart, which is appointment reminder function. This function displays a reminder for appointments. It takes three inputs, which is doctor name, doctor room, and also time. This output is a message displaying the doctor's name, room number, and the appointment date, appointment time. This slide summarizes the flow of functions related to calculating total, display available doctor times, and also reminding patients of their doctor appointments.
So here is the samples of output.